Hi, my name's Emily. I'm going to be the nurse practitioner doing your heart and lung exam today. Can you introduce yourself with your full name and date of birth?
Zachary Seach, December 23rd, 1993.
Okay, so I'm going to have you lay down on the bed and we're going to start with your exam. So to initiate the exam, we'll start by assessing the patient's jugular veins for any distension. I'll have the patient turn his head to the left, and I will note that there's no distension of the jugular vein, and there's pulsation noted at the suprasternal notch. I'll also have the patient turn his head to the right, and note again pulsation at the suprasternal notch with no distension. I'm going to measure from the site of pulsation to the notch, and note that it is approximately 3 centimeters. So that is normal. You can relax your neck. Then we'll go ahead and assess the carotid pulses. I'll also assess the left and the right separately. I'll palpate to make sure they are present. Both are present with a brisk upstroke, and then we'll auscultate. And I'm going to note that there's no bruits or thrills noted. So I'm going to assess the patient's chest. I'll note that it's symmetrical. There's good coloring. It's not pale or cyanotic. There's no abnormal pulsations, retractions, heaves, or lifts. So we will begin our palpation of the chest, and I'm going to palpate the apex. Actually, we'll start at the suprasternal notch and go down the sternal borders. Now end at the apex, and note that there is a pulse present with no thrills. Also, I'll note that there's no masses, tenderness, depressions, or crepitus during palpation. We'll move now to auscultation of the heart. First, we'll auscultate for normal breath sounds, and then we will listen for bruits. During this auscultation, I'm going to listen to the pulmonic area, the aortic area, the tricuspid area, mitral area, and Erb's point. So I will start by listening for normal heart sounds. Normal S1 and S2 are noted, and now I'll listen for bruits. Sorry for murmurs. And no murmurs are noted on auscultation. Now we will move to our peripheral vascular system assessment. We'll start with auscultation at this point. So first I will listen to the aorta at the epigastrum. I will listen with the diaphragm and the bell of my stethoscope. And then we will work our way down to the iliac, renal, and femoral arteries. Again, listening with the diaphragm and the bell of the stethoscope. Can you move your hands, please? I will note that no bruits were heard on auscultation. Then we will begin with our palpation. Again, I'm going to palpate the aorta above the belly button. Okay. And I'll also note that no tenderness is noted. Okay, so now we'll assess the patient's extremities, starting with the upper extremities. I will note that both his arms are symmetrical and have good coloring, no paleness or cyanosis. So we'll palpate from the shoulder to the fingers and assessing capillary refill, and it is less than 3 seconds. I will note there's no swelling or abnormal warmth on either of the extremities. And we'll check our pulses, radial and brachial pulses. And all pulses are good and present. Now I'll assess the patient's lower extremities. I'm going to start at the hips and I'll work my way down. Again, I'm going to note that both the legs are symmetrical, good coloring, no cyanosis. There's no swelling noted, no pain. We'll indent into the ankles to check for any pitting edema, and no pitting edema is noted. While I'm down here, I'll assess the pedal pulses. Assess the post-tibial pulses. And then can you bend your knees, please? And then the popliteal pulses. Okay. You can relax your legs. I'll also note during this time that the patient does have hair on his toes. Lastly, we'll assess the Holman sign. So I'll have the patient dorsiflex his feet, and I will apply pressure, squeezing the calves. Any pain? No. So that would be a negative Holman sign. And that's negative on both the lower extremities. Okay, so moving to our respiratory assessment, I'm going to inspect, actually let's move you to a chair. Okay, so now we'll begin our respiratory exam. I'll start with inspecting the patient's chest. I'll note that there's no tripoding. He has an easy time breathing. He has a normal rate and rhythm of inspiration and expiration. His AP to lat ratio, can you turn sideways just for 1 second? His AP to lat ratio, okay, go ahead and turn forward, is 2 to 1. There's no cyanosis. I don't see any protruding or overly prominent ribs, and no abnormal audible breath sounds. Can you put your fingers together for me? Okay, and no clubbing is noted of the fingers either. So we'll begin our assessment with auscultation first, and then move to palpation and percussion. So we will auscultate breath sounds anteriorly first. Take a nice deep breath as I move my stethoscope. Okay. Anterior breath sounds are clear, and no wheezing, rhonchi, or any abnormal breath sounds are noted. Okay, now we'll have the patient turn with his back to the camera. Okay. And we will assess breath sounds on the back. And we'll start at the brow line and work our way up. Can you lift this arm for me? Okay, and we'll go to the opposite side. You can keep that arm down for 1 second. Okay, now lift your arm. Okay, great. Yeah, break from breathing heavy. Okay, so now we'll move to the palpation portion of this assessment. I'll start at the top of the spine and I'll work my way down with my fingertips, pressing and wiggling back and forth, and have the patient tell me if there's any tenderness noted. Okay. And we'll end at the iliac crest, and there's no pain, tenderness, abnormal masses, or crepitus noted during palpation. Okay, so now we're gonna start at the brow line. I'm going to press my fingers in and have the patient take a deep breath. And I will note that there's a symmetrical expansion of the lungs. Okay. Now I'll start at the brow line, and I'll have the patient say 99 repeatedly as I move my hand. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
I'll note that vibrations are symmetrical throughout that exam. And lastly, we'll percuss, again, starting at the brow line and working our way up. And there's no abnormal sounds noted on percussion. And there's normal resonance. And that concludes our lung and heart exam. Thank you.